Good afternoon. I'm Sarah Edwards, the Director of the Division of Child and Adolescent Psychiatry at the University of Maryland. We're excited to have you join us today for the opening of our brand new Child and Adolescent Psychiatry Inpatient Unit. This unit has been thoughtfully created to allow us to provide world-class care for the children of the state of Maryland. Our trauma-informed design enables children to have an environment of comfort and calming qualities to support their healing. Please join me as I give a tour of our brand new unit.
Welcome to the University of Maryland Medical Center's Child and Adolescent Psychiatry Inpatient Unit. This space, and everyone who works here, is dedicated to helping children heal in a soothing and caring environment. Here is the area for our younger children. It is wide enough for lots of interaction, and it was designed to encourage movement and play, with a Lego wall and several activities on the floor, like hopscotch. Around the corner is the area for teens, which includes a grooming station where hair can be done. There are a total of 16 beds on the unit. Every room has a nature theme, as well as a soothing sound option. Take a listen. Whiteboards allow for patients to personalize their space. During the day, patients are encouraged to be out of their rooms. This area is called the front porch, where again we focus on nature. This mural and all the artwork inside was designed by Baltimore artist Annie Howe and helps this area feel calm yet fun. Here, we like for patients to socialize. When a child needs a break from activities or a quiet spot, we have alcoves throughout the unit. Other areas to note are the classroom and the sensory room, where you can look up and you can see the stars, and maybe a rainbow of color. Children eat together in this room that is filled with natural light. In the activity room, children play games, color, and take part in art projects. Every detail of this unit was designed with a child in mind. They may be in the hospital, but we still want kids to be kids as they heal and grow stronger.
Good afternoon. I'm Kim Sadler, and I am the nurse manager of the Child and Adolescent Psychiatric Unit at UMMC. I've had the pleasure of working here for 20 years, and every day I am honored to care for children. Our unit helps to stabilize children and adolescents and help them and their families to function in their everyday environments. I would like to introduce you to one such family in this next video clip.
It took so long for him to open up that when he did, it's like he blossomed, and they sowed the seed for it. It gives me a lot of hope for him that I didn't have when he first started going through all the things that he was going through. Now I have hope. My son wants to cook in the kitchen and bake. This is not the child that would be scared under the covers and would hear the voices and couldn't go to the bathroom by himself. He is a totally different person now. He started young and self-harming and hearing voices and having so many problems. I didn't know what to do. And then when I got with university, they were so patient and kind, and I really appreciated it. I felt like there was no judgment or making me feel bad as far as not knowing what was going on or how to handle things with him. So they walked me through every step of the way. And then they kind of became like a extended family. They offered other resources, and I felt as though they stepped outside the box. So some of the other programs that they referred me to, like Children's Choice and B-Cars, it became a good team, a good fit for him. So everybody worked together. They were so good with communication. Morning, noon, and night. I mean, I was even able to contact them on the weekends if I had to. And they were so supportive. And I've never felt so comfortable with my son being able to go in inpatient, because it's hard when your child is young. And then for him to never be away from me and have to go in there, it broke my heart. But they held my hand, they took me through the steps, and they were so kind that he was able to still feel safe even though he wasn't with me. So that was definitely a good experience for me. And I would honestly recommend them to anybody, and I have to several people, because of how good they were with him, and they still are. After all these years, they still are. I don't know where I would be myself emotionally without their support, because they don't just focus on the patient, they also focus on the family so that everybody can be okay. So yes, I would recommend y'all. I love y'all to death, and I thank God for y'all being there.
Good afternoon. I am Dr. Mohan Santha, and I am humbled to serve as the President and CEO of the University of Maryland Medical System. I have proudly spent all of my career as a member of the medical community here at the University of Maryland Medical System and within the University of Maryland School of Medicine. Before this role, I was proud to serve as the President and CEO of the University of Maryland Medical Center. As our academic flagship, we know that the mission of the Academic Medical Center is to deliver the care of today while we think about and develop the cures of tomorrow. We also take on the care delivery of our most vulnerable members of our community. While at the medical center, working with Dr. Joe Rockbeisel and an incredible team of dedicated leaders in the behavioral health program, we recognized that we had an unmet need. And that unmet need was very specifically, again, around some of our most vulnerable members of our community. The need for resources in adolescent behavioral health is dramatic, not just here in the city of Baltimore, but around the state. Recognizing that need, and with the unabashed advocacy that came from Dr. Rockbeisel and her team, we made the decision to invest health system resources in developing a state-of-the-art adolescent behavioral health care unit. Now, like many investments such as this takes years to actually go from concept to design to actually fruition, and we're ecstatic that today is a day that we recognize the completion of that commitment. Now, as I've moved into my current role, I'm so pleased that Dr. Bert O'Malley agreed to join us as the new President and CEO of the University of Maryland Medical Center. Part of Dr. O'Malley's excitement about coming to the institution was recognizing who we are, the mission we serve, and the commitments that we have to our communities. That kind of commitment is what allowed Dr. O'Malley and team to see this project through to fruition. And so with this, I'd like to turn it over to my friend and colleague, Dr. Bert O'Malley.
Thank you, Dr. Santha, for your efforts and passion for this project. It was under your leadership in 2019 that we received regulatory approval from the Maryland Healthcare Commission to build a new pediatric inpatient psychiatric unit. The new unit modernizes our space and provides a wonderful and safe haven where children and teens can receive the highest level of care for their mental health needs. The new unit will provide a critical needed increase in capacity from 9 to 16 that we're confident will help address the growing demand for inpatient mental health services among those aged 5 through 17. The services provided by the unit's care teams address a full range of mental health conditions. Not only do we treat patients with schizophrenia and substance-induced disorders, but we serve many children and teens with challenges related to mood, trauma, anxiety, attention deficit, hyperactivity, and neurodevelopment conditions. Our patients and their family members have long been grateful for the superb inpatient care they've received from us, and we are thrilled that this new unit will enhance our ability to provide these services and help even more young people within our community and across the state. That we've been able to offer such a high level of stellar pediatric mental health care for so many years is due to the incredible multidisciplinary effort and partnership between the Department of Psychiatry and our UMMC team. I personally want to thank every member of this collective team and partnership for their dedication to battling mental health challenges and providing the highest level of care to our patients. I would like to highlight a particularly talented leader and champion for adolescent mental health and well-being, and that leader is Dr. Joe Rockbeisel, who serves as the Dr. Irving J. Taylor Professor and Chair of the Department of Psychiatry at the University of Maryland School of Medicine and the Chief of Psychiatry at UMMC. Dr. Rockbeisel has been a rising star since her residency here at the department at the University of Maryland, and she is an outstanding clinician, educator, research collaborator, and administrator. She serves as a role model for her faculty, residents, and medical students. Without further ado, here is Dr. Rockbeisel.
As the newly instated chair of the Department of Psychiatry, I couldn't be more pleased or more proud of our new Children and Adolescent Psychiatric Unit. One of our priority missions in the Department of Psychiatry is to serve the community by providing access to desperately needed services to one of our most vulnerable populations, the children and adolescents of Baltimore City. In the state of Maryland, we are doing just that. Our new state-of-the-art unit will provide crisis stabilization and a place to recover in an environment that is sensitive to individuals who have been exposed to trauma in their lives. We will provide person-centered, evidence-based treatment that is connected to the entire family. Our new program will provide a healing environment that is calm and restorative, where children, adolescents, and their families will experience the highest level of support as they deal with mental health issues and regain hope. With the multidisciplinary approach to care, all aspects of a person's life will be touched. Social connectedness, educational and interpersonal development, and physical health are all critical aspects of normal growth and development of our youth, and these are intricately woven into the care provided in our program. Baltimore is a great city. Our new program will provide the support and mental health care for our youth, their families, and the communities in which they live. Our program will make our city better every day. I want to thank and congratulate Dr. Sarah Edwards and her entire team for bringing this program to fruition. Thank you.
It is a real pleasure to be here to participate in the opening of the Child and Adolescent Psychiatry Unit. As we have worked together during the COVID pandemic to provide care for the children and families of West Baltimore and beyond, it's become clear that mental health issues are a major issue for our local community. Not only are mental health issues being addressed on a daily basis as we take care of the children of West Baltimore, but we've identified a subset of adolescents that are in need of intensive psychiatric care. This new child and adolescent unit will give us the opportunity to provide these children with the type of care that they need to help them overcome the impact of COVID and the local environment that has resulted in these psychiatric issues. This is a major step forward for our community, and this new unit will allow us to finally provide cutting-edge care for these patients in a beautiful new inpatient facility. This is a welcome new addition to our resources for providing for our community. At this time, I would like to introduce Dr. Sarah Edwards, who's the medical director of the Division of Child and Adolescent Medicine.
Good afternoon. The new Child and Adolescent Unit is the culmination of many years of collaboration, planning, overcoming obstacles, and creating an opportunity to ensure that youth who have mental health needs have access to safe, warm, high-quality care. Each day, our dedicated employees provide youth with encouragement and positive relationships which empower them to heal and build resiliency. The gift of our new unit belongs to everyone who worked to make it a reality, and I'm extremely honored and privileged to take a few moments and express my appreciation. Thank you to the hospital leadership, Dr. Suntha and Dr. O'Malley, Dr. Greg Raymond, Dr. Lisa Rowan, Joe Hoffman, Allison Brown. Thank you for supporting projects that encourage and allow children to have brighter futures. A special thanks to Dr. David Pruitt and to Dr. Jill Rockbeisel. Expansion of this unit happened under their leadership, and they provided us with perspective and direction that put us on the right path. To the very creative and talented design team, Kevin Day, Scott Holmes, Brett Ellum, and Linda Whitmore, thank you. Thank you for sharing the vision of creating an environment which reflects our core value of respect, and communicates to patients a sense of hope. Patients will know that their mental health matters just as much as their physical health. To the planning and strategy team, Kim Sadler, Kat Webster, Scott Tinsley Hall, Dana Farrakhan, Pooja Bhatnagar, and Marilyn Solomon, I appreciate the cooperative spirit and attention to detail that enabled us to achieve our goals. To the clinical team, Dr. Katrina Oscuro, Dr. Summerholder, Dr. Suman, Kendra Jones, Jen Myers, Pam Walker, Megan Perlman, Jim Early, and Cindy DiFrancesco. Thank you so much for supporting trauma-informed care. I'm inspired by your innovative and resourceful ideas. Those who work in an inpatient psychiatric unit know the rewards and challenges that come with helping youth overcome emotional difficulties. And it is with heartfelt thanks that I recognize the incredible care of our entire team. We have a large interprofessional team made up of nurses, psych techs, mental health associates, psychologists, psychiatrists, social workers, occupational therapists, psychiatrists, child life specialists, environmental services, unit secretaries, nurse practitioners, and security team. Yes, it truly takes a village, and I'm privileged to work alongside these compassionate individuals who help our children. Mr. Rogers said, "We live in a world in which we must share responsibility. It is easy to say that is not my child, not my community, not my problem." Then there are those who recognize the need and respond. I consider those individuals my hero. Well, that large group that I just mentioned of individuals who work on our unit day in and day out are my personal heroes, and I appreciate everything that they do. Thank you so much. Please enjoy the upcoming video that expresses our gratitude towards the both past and current heroes of the child psychiatry team.
When I was first in nursing school, I said there were two things that I would never do, and that was pediatrics and psychiatry, and somehow here I ended up, and I love what I do. What's so special about child and adolescent psychiatry is definitely the people that work there. Many of us have been there for a very long time.
I first came here as a volunteer, and the reason why I volunteered because I came first as a patient, a parent of a patient. I brought my son here and he was going through some stuff, so me volunteering at the hospital, that was my way of giving back, appreciating the work that they did with my son. And so I've been here ever since, and that was back in like '97.
I'm the first person that they see when they come in the door. And if they see me, greeting them and assuring them that they're gonna be okay, do this day, then I feel as though they make a good impact on them while they're there.
I'm proud that all of the different disciplines can kind of come together to kind of problem solve and figure out what we need to do in order to make this child and their families, for the most part, be successful.
I understand the children, and I come from some of the same environments they come from. So I just basically wanted to pay it back to them, the same hope I have for myself, I have for those kids.
A lot of them don't want to leave because the kid there is so great that they love being there with us.
I see some of the kids that I worked with years ago that are adults now, and they are functioning. They are working, self-sufficient. Some of them have their own place and everything. So that's a good feeling to see that.
What I'm looking forward to the most in regards to the new space is being able to revitalize not just the program itself, but also our commitment and our energy.
On the unit, we had like a feeling of home in the staff that we have, but now I feel like it'll be a feeling of home in the space as well.
I'd now like to introduce Dean Albert Reese. Dean Reese is the Executive Vice President of Medical Affairs, University of Maryland, Baltimore, the John Z. and Akiko K. Bowers Distinguished Professor and Dean of the School of Medicine. He is also professor in the departments of Obstetric and Gynecology, Medicine, and Biochemistry and Molecular Biology. We are honored to have him here with us today.
Thank you, Dr. Edwards. I'd like to congratulate you, Dr. Suntha, Dr. O'Malley, Dr. Rep Beisel, and all of the University of Maryland Medical Center employees who have had a role in building and opening of the new inpatient child and adolescent psychiatric unit. I know this was a very large undertaking, and now you'll be able to provide these essential care services in an environment most befitting for your patients. The unit is now much more illustrative of the outstanding and model care program for children and teens that you have created under the guidance of Dr. Rick Beisel. Congratulations. So now I invite all of us to cut the ribbon and officially welcome the Child and Adolescent Psychiatric Inpatient Unit.
Congratulations, Child and Adolescent Psychiatry. It has been a pleasure to present this beautiful new unit. This concludes our ceremony, but the work in our inpatient unit is just beginning. Each day, we meet the mental health needs of youth across our state. Thank you so much for joining us today.